What if I told you that many cancers don't have to happen at all? Not because we've discovered a miracle cure, but because modern medicine has learned how to prevent many cancers before they ever begin. That may be one of the most encouraging discoveries in cancer research. When people think about cancer, they usually think about treatment. But today, one of the biggest victories against cancer happens long before any of those treatments are needed. It begins with prevention. The first line of defense is simple: the choices we make every day. Avoiding tobacco remains the single most powerful step anyone can take to reduce cancer risk. Regular physical activity, maintaining a healthy body weight, limiting alcohol, drinking enough water, and eating a diet rich in fruits, vegetables, whole grains, and fiber help reduce chronic inflammation, strengthen the immune system, protect our DNA from damage, and lower the risk of many common cancers. On the other hand, diets high in processed meats, excessive salt, and heavily processed foods are associated with increased risks of cancers such as colorectal and stomach cancer. But prevention doesn't stop with lifestyle. Many cancer-causing agents exist in our environment. Ultraviolet radiation from the sun is one of the leading causes of skin cancer, including melanoma. Air pollution, asbestos, industrial chemicals, and toxic workplace exposures can also damage DNA over many years. Fortunately, simple measures such as using sunscreen, wearing protective clothing, following workplace safety guidelines, and reducing unnecessary exposure to harmful chemicals can significantly lower these risks. Perhaps even more fascinating is the fact that some cancers can actually be prevented by preventing infections. Viruses such as human papillomavirus, or HPV, are responsible for nearly all cases of cervical cancer and also contribute to cancers of the throat, anus, penis, vulva, and vagina. Hepatitis B virus increases the risk of liver cancer, while the bacterium Helicobacter pylori is a major cause of stomach cancer. Vaccines originally developed to fight infections are now also preventing cancer. HPV vaccination dramatically reduces the risk of several HPV-related cancers, while hepatitis B vaccination has already lowered liver cancer rates in many countries. Treating Helicobacter pylori infection before long-term damage occurs can also prevent many cases of stomach cancer. Perhaps the greatest weapon we have, however, is something many people overlook: screening. Cancer often develops silently for years before causing symptoms, but modern screening allows us to detect disease long before a person feels sick. A mammogram can reveal tiny breast cancers years before they become noticeable. A pap smear can detect abnormal cervical cells before they ever become cancer, allowing doctors to remove them while they're still harmless. HPV testing identifies people at higher risk long before cancer develops. A colonoscopy is even more remarkable. It doesn't just detect cancer, it can actually prevent it. During the procedure, doctors can remove precancerous polyps before they have the chance to transform into colorectal cancer. Few medical tests have the power to stop a cancer before it even exists. For some individuals, prevention also includes understanding inherited risk. People carrying mutations in genes such as BRCA1 or BRCA2 have a higher lifetime risk of certain cancers. Knowing this risk allows earlier screening, closer monitoring, and sometimes preventive treatments that save lives. At the same time, supporting our immune system through adequate sleep, regular exercise, stress management, balanced nutrition, and routine medical checkups helps our bodies recognize and eliminate abnormal cells before they become dangerous. One message stands above all the rest: cancer prevention is not one single decision. It is the result of hundreds of healthy choices made over a lifetime. Every cigarette you never smoke, every healthy meal you choose, every vaccine you receive, every sunscreen you apply, every screening appointment you attend. Every one of these decisions protects your cells, reduces DNA damage, and shifts the odds in your favor. And perhaps that's the most hopeful lesson in all of cancer biology. The best way to fight many cancers is to stop them before they ever have the chance to begin.